Hi, my name is Eva.
Hi, my name is Abby Browning.
Hello, my name is Chelsea De La Cruz.
Hi, my name is Maya Delgado.
Hi, my name is Melanie Forster.
My name is Eugenia Hernandez.
Hi, my name's Eva.
Hi, my name is Alexandra Richardson.
Hi, my name is Lily Turner.
I did meet some people in my class. I know a couple girls and that was really nice. Like, these girls were really fun. My instructor was Miss Friedman and Miss Grisham, and now also Mr. Lee. And my favorite part about class was worksite days. Those were pretty fun because we actually got to do things. So I was at Indiana Nephrology and Internal Medicine, and I was a medical assistant there along with other medical assistants that were employed there.
Experience at KLR was very positive and hands-on. My instructor was Miss Friedman and my instructor assistant Mr. Lee, formerly Miss Grisham. I started taking one semester of online Zoom classes, followed by my second semester my senior year going to in-person clinical rotations. Favorite part of class was definitely when I went for my in-person rotations. I met a lot of friends through our in-person skills day and then other interns here at my site. And a lot of those connections did turn out into friendship.
I completed my one semester of rotations at the Aspire Indiana Health Carmel location as a medical assistant. As a medical assistant here, I roomed patients, obtained vitals, completed UDSs, charted information on patients, and completed robust calls. Some of my favorite moments here were just conversing with the patients and the other employees. Everyone here is super sweet and they all welcomed me, and I just had a really great time getting to meet everyone and learn new things.
We're Mrs. Friedman and Mr. Lee, and my favorite part of the class was being able to meet new people that had the same interest as me.
My time at KLR was really good. My instructors were Miss Friedman and Miss Grisham. My favorite part of the class was definitely playing all the Kahoots and like the role-playing games that we would play. And it's super easy to make friends in there because you're all really in the same boat, just learning something new every day. So it's really nice to have someone like that.
I'm currently a senior at Roncalli, and this is my second year participating in KLR. Last year as a junior, I completed my class on a Zoom call. I took my NHA exam at the end of May last year, and now I'm graduating this May. My instructor in the program was Miss Friedman, as well as Mr. Lee and Miss Grisham. My favorite part was learning new procedures, getting to do things hands-on, and getting to interact with the patients. I also became really close with the two MAs in my office as well as the new intern.
And so far my experience at KLR has been excellent. I've learned everything about it and I've learned a lot.
It kind of changed based on the days, so because we didn't see patients every day in the clinic. We only saw them like once or twice a week. But most days it was just full. It was pretty mellow days, you know, not a whole lot going on, which is, in my opinion, pretty nice, you know. But it contained a lot of paperwork, so like scheduling patients, taking referrals and entering their information, sometimes creating patient charts for new patients that we never had before, entering referrals, faxing over referrals, receiving faxes, receiving lab orders, going through lab orders, filing a lot of PHI, things like that, just things with mostly paperwork.
I am currently an intern at Indiana Neurology and Pain Center, INPC, where I work as a medical assistant. A typical day includes rooming patients, recording medical histories, and taking vital signs. I also assist with procedure preparations such as drawing up Botox injections, and I also observe specialized procedures like our EMG. And lastly, our vagus nerve simulations have helped me understand both patient care and clinical workflow.
My site is Indiana Neurology and Pain Center, and I am a medical assistant. So I start off my day walking in here at 12:25 to give me 5 minutes to prepare for the day. And then I start rooming patients by building their charts and then calling their name so I can put them in the room. My favorite moments here at this rotation site is when I'm able to provide a comfortable environment for the patients as well as collaborate with people in the medical field.
Rotation site is Indiana Pain and Neurology Center, and I'm a medical assistant. The day looks like for me here is I build patients' charts, room them, and then take their vital signs. This site is at Indiana Neurology and Pain Center, and I'm a medical assistant. The life here is I come in to build a patient's charts, and then I put them in a room so that I'm able to take their vitals.
I'm at the Aspire in Carmel, and my role is a medical assistant. A day in my life typically consists of robust calls, vitals, just rooming patients and cleaning, but sometimes I get to draw blood once in a while. Something fun that happened while I was here is all the MAs got giant cookies from like a local bakery, and the cookies were really good. And something rewarding is when I first learned how to use straight stick instead of butterfly, and it was actually a lot easier.
I've been a medical assistant at Indiana Neurology and Pain Center since August. I've worked on the neurology side for the majority of my time here, but I have also helped in the pain side before. A typical day at my internship is I go and room patients, I grab their vitals, and I go back and chart it. Sometimes we have conversations, sometimes we don't, as well as doing different administrative tasks, checking medication, as well as helping and observing some different Botox procedures or an EMG.
So a day in my life here kind of looks like I get here and I sit down and I open my computer and I see what I have to do that day or how many patients I have, and I prep for that. I will take the patient back, take their vitals, like their weight, their blood pressure and all that. And I'll ask them a couple questions. So that's pretty much what I do all day, and sometimes I will help with labs, and I will assist in procedures.
Some of my favorite moments from that were honestly just like building connections with the nephrologists that I was with, the nurse practitioners I was with, and the medical assistants that I was with. They were super nice. They were super like fun to be around. They like made my learning experience super easy and like really enjoyable and all that fun stuff.
One of my favorite moments working with an INPC was when there was a patient that was very anxious about their condition. I took time to listen to them and reassure them, and it really showed me how important communication and empathy are within the health field. I also enjoyed mentoring other interns with charting and rooming patients because it helped me build confidence within my leadership skills.
Some of my favorite moments here was first being easily welcomed by the staff and just asking the staff questions when I needed help.
My favorite part about being an intern here is definitely getting to interact with all the different patients. Here since August now, I have seen the same patients multiple times, and I have generally formed connections with them, as well as the connections I have formed with my other MAs and getting to watch their experiences and watching us grow and learn together.
Some of my favorite moments are definitely when the MAs will order like donuts or like sweet treats for all of us, and we'll get a little treat while we're working during the day because we work very hard. I just feel that's important to grow and to bond as one.
Some soft skills that I learned during rotations. A big one that I really learned was honestly just having basic conversations with patients, because sometimes patients would come in and they would start telling you their whole life story, the reason that they're in there, and that's always like in the beginning I think it was a little bit awkward because like I didn't really know what to do with all the things that they were telling me and all that fun stuff. But I mean, you know, like as rotations went on, it got easier to just kind of like have like, you know, automated responses, you know, like learning how to be an active listener a little bit better and talking to them and having full conversations with them, and honestly it was just pretty enjoyable about that. It was really just vitals, and then if we had a new patient, we would have a new patient complete a urine sample test, and that's honestly like a new one that I learned how to do. It was just super simple, and just take the specimen and drop it on a lab, like a test strip, goes in a machine, the machine reads off numbers, and yeah. But other than that, it was just basic vitals like blood pressure, pulse oximeter, and that's about it.
During this rotation, I obtained a lot of soft skills, including communication, active listening, professionalism, and time management. I also developed stronger emotional intelligence when working with patients that felt unsafe and undervalued. Being adaptable and team-oriented also played a really important role in this environment. The skill I improved on was adapting to patient care techniques, such as taking blood pressure on the forearm when patients had difficulty taking off heavy clothing. I also became more confident with patient roaming, charting accuracy, and assisting with clinical procedures.
A couple of soft skills that I use is that I'm able to make good small talk, so I'm able to provide that comfortable environment that I mentioned before with the patients and get well by. And then another skill that I use is good time management. Along with my clinical duties, I'm able to get homework done that is a part of my school as well as the KLR program. Some skills that I've mastered is building new patient charts as well as just regular patients. The process is a little bit different, but basically you have to build the whole charts, put in their pain levels, and with their medical information for sure.
Some soft skills that I utilize during this clinical rotation is being able to talk to patients while still prioritizing time management. Some tasks that I mastered at this clinical site was calling patients back, asking them to confirm their date of birth, and taking them to the urine testing station.
A few of the soft skills that I utilized and bettered while working here at Aspire as a medical assistant would be my public speaking and just communication overall, especially talking from patients to providers or other coworkers, but also my adaptability. There are many skills that I had to learn and master while being an extern here at Aspire as a medical assistant. One of those was my charting skills. An additional one would be learning how to perform a urine drug screening or different types of tests for patients.
Some of the soft skills that I used during clinical rotations were time management, being professional, and talking to the patients. The skills that I've mastered here at this rotation site is being able to build new patients' charts, but also being able to chart whenever a patient needs a brace.
Soft skills I utilized during my time at rotations was a lot of public speaking and being polite. Sometimes during the robust calls, patients will get a little hot-headed because sometimes it's hard to understand what the other person is saying and it just gets mumble-jumbled. So you gotta try to remain calm and solve the situation on your own. And I've happened to get really good at that. So some tasks I have mastered is doing vitals. I'm in and out in 2 minutes. And something I've almost mastered is pronunciation of medications, because some of them you just look at them and you're just like, I don't know how to pronounce that, but the patient will help you.
My communication has definitely improved between talking to reps, talking to patients, talking to our doctor, and even emailing my preceptor.
So some soft skills I've utilized would definitely be empathy and compassion are two really big ones. Empathy being the biggest one, because some people you have come through just heard news that they didn't want to hear or are having a rough time dealing with certain things. So it's very important to be empathetic through that. And I've learned a lot of critical thinking and fast thinking, because sometimes you don't always have time to think things through before they happen. So some tasks I have mastered would definitely be, I had trouble recording height at first with like the thing, but I've definitely mastered that now and I'm definitely good at that now.
One challenge that I faced here was learning how to stay calm and efficient when our clinic was running a bit behind. I overcame this by staying organized, communicating with staff, and focusing on one task at a time.
So the main challenges I faced was just having the courage to ask questions. I don't want to be a bother, but if you're curious, ask it.
Some challenges that I faced was not being able to have a public speaking voice, but what made me overcome this challenge was practicing until I felt comfortable.
Some challenges that I faced while working here as an extern would just be adapting to all the constant changes. There's always new people, new providers, new employees, different situations that I'd never had to deal with before, and sometimes they were awkward or just frustrating, or it was difficult for me to follow up with, or a patient, and I didn't feel like I could provide the right help. But I felt like with all the things I learned here, my critical thinking skills and a positive attitude, that even when I was struggling or having a difficult time, I made the best of it.
The challenge that I came across at this rotation site was not knowing how to build a new patient's chart. And the way I overcame this challenge was by asking the staff here to teach me step by step on how to do so.
One unexpected experience I had was actually during a robust call. A patient needed an interpreter, and we have to get on a certain website to request an interpreter and talk to them. But unfortunately, there was no interpreter available for this language, so I overcame it just by telling them I'll call back later.
One of the biggest challenges I have had to face since working here has definitely been dealing with difficult patients. Whether they were upset, they were angry, they were dealing with some pain. Regardless of the situation, it has been very difficult to navigate at some points.
I would say just be open-minded, especially like with placement of your rotations. I think that one's a big one because I think some people have these like predetermined expectations or like, you know, hopes of where they want to be at, and I say just be open-minded. I would never think that I was going to be enjoying nephrology. To me it sounded like super intimidating, and I'm honestly really glad that I was placed at the spot that I was at because I built some really good relationships with the people that I was with, and they were amazing.
My advice for future KLR students is to take every opportunity seriously. Even if it feels small at first, ask questions, stay engaged during class, and do not be afraid to make mistakes because that's how you truly learn. Also, be prepared to step out of your comfort zone, especially once you start rotations, because that's where most of the growth happens.
Advice I would give is just to kind of develop new study habits, have good time management, and be prepared to learn.
Advice I would give future KLR students is to study well all the material your instructor gives you and to not be afraid to go into clinical rotations.
The best piece of advice I would give to future KLR students is just to come in with an open mind. You can always learn new things. There's stuff that you might think you're prepared for, and you definitely are prepared for, but just coming in with an open mind, being ready to learn and ready to have a good experience.
To not be afraid to ask any questions, but also don't be afraid to start off the program, even if you have no medical knowledge.
Advice I have for future KLR students is to have fun in the class, participate in the class. No one's going to shun you because you get the wrong answer. It's a way for everyone to learn. And also to study. Study. Just don't pack all your studying in one night. Space it out. Do the Kahoots that they provided for you. Your notes help a lot, and look at all the presentations and you will be all right.
My biggest advice for future KLR students is to definitely stay organized, whether it's at home or at the office. Especially my junior year, I always made sure I had all my work. I was on my Zoom call the moment I needed to be, and I always had my notes and my computer and everything set up for me.
It would be a place where I could ask for help in a way that actually made me learn and grow through real clinical experience.
KLR is a program that allows students to get a sneak peek of the medical professional field as well as in academic settings and professional settings.
KLR is a very helpful and supportive program.
It is a worthwhile experience, and it definitely helps prepare you for your future.
By saying it's a place that you can succeed. Your instructors will strive to push you to that end goal. They will not let you fall behind, and it's so rewarding once you get there and you do succeed. So yeah.
I had the opportunity to gain real world experience as well as hands-on experience in the healthcare field.